different types of bones, how they are classified, and we discussed a few bones also, like which are the long bones, which are the flat bones, which are the irregular bones. Now we have a special session where we discuss only about the scapula. In the previous session we have seen that it is a flat bone, and we try to identify the flat bones, how they differ from the long bones, and what are the basic features. So I thought like we'll begin with live sessions on the individual bones and their osteology. When we consider the osteology points regarding scapula, when you look at the bone itself, you can easily say the shape of the bone, that it is triangular in shape, and being a triangle, it has got a peculiarity that it will have 3 angles and 3 borders, and apart from that it has got 3 processes. So we'll begin with the first one, the 3 like how the 3 angles are formed. When I hold the bone in the anatomical position, you can see one angle on the top, that is the superior angle, and one on the bottom, that is the inferior angle, and the one on the right side that you can see here, this is the lateral angle. So these are the 3 angles. When we consider the 3 borders, you just have to connect the 3 dots, superior, inferior and lateral. Consider them as 3 dots. When we connect them together, they form the borders. So when we connect the superior angle with that of the inferior angle, this thin border that you can see here is the medial border, which is the sharpest. Then on the lateral angle and the inferior angle is connected by a thick border, which is visible here, that is the lateral border. And on top you can see the superior angle and the lateral angle is connected by a thin border, that is the superior border. So we have 3 angles now, superior, inferior and lateral angle, connected by the superior border, medial border and the lateral border. So these are the boundaries. And when we consider the flat bone, you can see there is a concavity and there is a convex surface behind it. So this concave surface, which you can feel here with some corrugations, this is actually the surface which is lying in close contact with the rib cage, making it the costal surface or subscapular fossa. While on the posterior aspect, you can see on the dorsal aspect it is somewhat convex, but the problem is that it is separated into 2 sections by a middle projection that you can see here. If you look closer, you can see there is a middle projection, a shelf-like projection that is projecting backwards. This is called as the spinous process. So 3 angles, 3 borders, and to remember there are 3 processes, namely one you can see here, there is a flattened process that is called as the acromion process. Then there is a finger-like process which is projecting forwards, that is called as the coracoid process. And finally the one which I told you just now, the shelf-like projection that is projecting backwards. So that shelf-like projection is called as spinous process. So it is easy to remember 3, 3, 3. 3 for the 3 angles, then 3 borders and the 3 processes, the spinous process, acromion process and the coracoid process. So these are the 3 elements that you can remember easily. And 2 surfaces, that is the costal surface and the dorsal surface which is behind. So that concludes the basic understanding of scapula. Now we have to see the other external features. One I have already told you, the shelf-like projection, which is called as the spinous process, divides the dorsal surface into 2 sections that you can clearly see here. There is an upper triangular area here that is called as the suprascapular fossa, which is above the spinous process. It is also known as the supraspinous fossa. So this triangular area here is called as supraspinous fossa, and below that is called as the infraspinous fossa. So the spinous process divides the dorsal surface into an upper part and a lower part. The upper part is supraspinous fossa and the lower part is infraspinous fossa, while the costal surface, the concave surface, is called as the subscapular fossa. So these are the major things that you have to know regarding the osteology points in case of the scapula. So apart from that, when you look at the lateral angle, you can find an oval marking here which is slightly a shallow concave depression. So this one over here is clearly called as the glenoid cavity, which articulates with the humerus bone. So when you consider the humerus bone, you can see there is a rounded head here. That head will articulate with this particular glenoid cavity here. This is how they articulate with each other. So this is the glenoid cavity, and if you observe closely, above the glenoid cavity you can see a bony tip-like prominence, a small prominence over here which I am touching right now. That demarks the point which is called as the supraglenoid tubercle, and below the glenoid cavity you can see another bony prominence which is called as the infraglenoid tubercle, which is below the glenoid cavity. So these are the important points regarding the glenoid cavity. And when you consider the superior border, here when I am holding it right here, you can see the superior angle where it meets with the coracoid process. At this junction you can see a small depression which is called as the suprascapular notch, and on the other side where the glenoid cavity is making a contact with the spinous process, you can see a notch here. This notch over here is called as the spinoglenoid notch between the spinous process and the glenoid cavity. This is called as the spinoglenoid notch. So this is how you have to link them together. So I repeat once again, the three elements: superior angle, inferior angle, and the lateral angle, which is having the protrusions or the processes. Then the superior border connecting between the lateral angle and the superior angle. Connecting between the superior angle and the inferior angle, we have the medial border. Then we have the thickest border, which is connecting between the lateral angle and the inferior angle, that is the lateral border. Then we have seen three processes. The one projecting backwards, the spinous process, you can see it here. The triangular shelf-like projection that is projecting backwards. Then a flattened projection here. That process is called as acromion process. Then we have the tip of the coracoid process here, which I am touching right now. It's a fingertip-like projection. And these are the three processes. Then we have seen two notches. One over here, which is called as the suprascapular notch, and the other one which is over here, that is the spinoglenoid notch between the glenoid cavity and the spinous process. So these notches are actually there for the passage of some vessels and nerves. So that concludes the basics. And when you look at the spinous process, you can see that it is clearly forming a crest here on the posterior aspect. This is called as the crest of spine of scapula, which is having two sharp borders. There is an upper lip and there is a lower lip. So there is two lips for the crest of the spine, and that is having an upper lip and a lower lip. While when you look at the crest of the spine, as it meets the medial border, there is a triangular area which is formed here. So you can see a small triangular area here that is called as the root of spine. So this is the root of the spine, this is the crest of the spine, and this one over here is the spinous process, and this one over here is the acromion process, and this fingertip like process is called as the coracoid process. So these are the major points you should know when you are studying about the scapula, and each of these bony prominences and depressions, they are giving origin or attachment for different muscles. So we will be discussing about the muscular attachments in the upcoming sessions. So herewith I am concluding the scapula anatomy regarding the osteology points. So that is for today, and thank you for listening to me, and we will meet soon with another bone, and we will also include more muscular attachments and related queries will be answered in the upcoming sessions. Thank you.